Hi. Based on the picture of this brain and a picture of coronavirus, you can well imagine the topic of my presentation is the effect of COVID on CNS, especially on brain. Hi, I'm Dr. Asit Sikary, and in this presentation, I'm going to talk briefly about how COVID does things to brain, what it does to the brain, and what can we do to manage that. So, how does it do it? Now, this slide may seem busy, but it has only two things, and that is blood brain barrier and the blood vessels of the brain. So, what we can see is that coronavirus disturbs blood brain barrier and it also disturbs the circulation. If you see this slide, you will understand that as it enters into the brain through the olfactory bulb and then it disturbs directly the neurons based on various with the help of various inflammatory cells, and it also disturbs the circulation, and that circulation causes hypoxic ischemic injury to the brain. So again, brain injury. This is another way to show you the direct injury to the brain and the neurons and to the blood vessels. And there are many things like the presence of ACE2 receptors, then as I already said, hypoxic ischemic changes, blood brain barrier breakdown, and then sympathetic storm, hypercoagulability, and the RNA virus itself in the brain and CSF. These are all the mechanisms by which the virus can disturb our brain and spinal cord. And some indirect effects like lung damage and respiratory failure, it will lead to hypoxic ischemic damage, and then systemic inflammation and immune dysregulation. These are the some histological and anatomical changes which has been seen in the brain. Histologically, this is the route of entry, so it will get damaged and it does get damaged, and then neuronal injury and astrocytic injury. And anatomically, it has been seen that there is asymmetry of olfactory bulb and then decrease in size of the orbitofrontal cortex, parahippocampal gyrus, global brain size. Not only this, they have also seen hemorrhages into the cerebellum, into the cerebrum, especially around the pathway of middle cerebral arteries. What does it do? So it causes encephalitis, encephalopathy, anything what you can imagine, stroke, even GBS, and then necrotizing encephalitis, and then disseminated encephalitis, and all these mostly because of direct invasion or the post-infectious complications, mainly immune mediated, and sometimes pulmonary and systemic involvement. So all these direct involvement, post-infectious changes, and pulmonary involvement, they can cause these changes. If you see that most of the changes, they linger on, mainly the inflammatory changes and the spike protein and the damage to the blood vessels, they linger on, and they give you brain fog like memory disturbance, muscle and joint pain, involuntary twitching, and sometimes strokes, headache, migraines, and sometimes rarely, Parkinson's like effect, facial drooping. They can give you anything, commonly or rarely. And then they involve emotions. You can be depressed, there is some effect like that of PTSD. You can be anxious, and it's mainly because of involvement of all these structures which are involved in learning, emotion, memory, and olfactory valve involvement, which gives us pleasure, and a motivation to act, and all because of the stress to the brain. And this stress activates the HPA axis, and all the changes leads to the psychiatric symptoms. And then, as we're talking about brain fog, it's like chemo brain, the effect are same. And why this happens? It's mainly because of hypoxia and the mechanical ventilation, and then depression, anxiety, PTSD. If you have all these morbidities, brain fog is the chance, and it lasts for weeks or months. I don't know how the people with brain fog present. They present, they talk, and then they lost the train of thought, and then they can't follow the conversation. They are more forgetful, in a way their brain doesn't process things effectively as it should be. They are mentally and physically tired. So the question is, what can we do and how can we manage all this? And the main management is only supportive. Means if you see some symptoms, manage that symptoms based on the standard guidelines. In encephalopathy, role of immunomodulators are uncertain, but they say that steroid works. If there is cerebrovascular, stroke, manage stroke based on the standard guidelines. If there is coagulopathy, thrombotic disorder, you can use DOACs, like that. Means treat the symptoms as they come up. We can try to prevent this if you can minimize hypoxia, if you can protect the brain from cytokines and thromboembolic complications. And that's not easy. These are my references, and I thank you for your patience listening.